Well, the Missouri Center for Female Continence and Advanced Pelvic Surgery has really been a dream of mine and other people that have helped me put this together for a number of years. We're actually excited that we're going to be able to offer a wide variety of services in our center to women that come here. On the surgical side, which is more where I focus, we have become more focused on less invasive surgeries. For example, the routine operation that I would do for someone with stress urinary incontinence, which is a condition where a woman might cough, sneeze, or laugh and leak a little bit of urine. The procedure that we routinely do to treat that in the operating room, it takes about 15 or 20 minutes and is done through an incision that's less than 1 inch. Those women go home the same day of surgery. They feel back up to kind of their old self in about a week. If they're employed outside the home, they're usually able to go back to work in 2 to 3 weeks. The other thing I want to say about the center that I think is important for patients or potential patients to realize is that this center is focused on treating people the way they want to be treated. In other words, if you think that surgery is what you'd like to have, we have surgical options for almost all pelvic floor dysfunction. If you think that a non-surgical, less invasive option is what you want, we have those services available also. In fact, I work with a nurse practitioner, Julie Starr, who has focused her entire practice on non-surgical options for pelvic floor dysfunction. She'll take people with prolapse and fit them with a device that they can wear inside the vaginal canal that will provide support for the bladder or rectum. Alternatively, she can work with them with her biofeedback and pelvic floor physical therapy equipment to help them learn to use their own body to control their bowel or bladder.
I met Dr. Foster's wife Sharon through a church group, and she said what her husband does, and I thought, wow, I need that. That sounds like my problem. So I made an appointment and came in to talk to Dr. Foster because I would pick up my child and I would leak urine, or I would laugh, or I would cough, or I would sneeze, and I wouldn't be dry. So I knew that wasn't right. So I made an appointment and he came in and confirmed, yes, I did have that problem. I had no idea what to expect, and the staff was wonderful from the time you walk in till the time you leave. They're just fabulous, and they just hold your hand and rub your shoulder and tell you it's okay, and they just see this thing every single day because it can be embarrassing for a woman and they think it's not right. But when you come in, they're like, oh, that is totally normal and we can fix that and there's no need to be embarrassed. So they just put you at ease and very thorough in all the testing. And once I was completed with all the testing, I sat down with Dr. Foster in his office and he explained everything thoroughly and gave me my options. And he said, you know, you don't have to do this right away. There's no reason to do it like tomorrow. He said, but it's strictly up to you. And I told him I want it done because just for the quality of life it's provided, and not having to rush and find a bathroom every 30 minutes when you're out shopping or out with friends doing something. And so it's been a huge, huge difference in my life.
I think when it comes to female problems, that is a huge issue. To be able to retain your dignity through it, to be treated like there is no question that is a stupid question. They explain things in layman's terms where anyone can understand, but where you feel comfortable in saying, but what if? They're there. The smiles are there, the reassurances are there. It just means a lot to a person to be able to be a part of their treatment, to know what to expect, to know what, you know, when you're making great progress, they seem as happy as you are for it. And the screens and things that they use, they let you see on the monitors exactly how you're testing out and what you're doing. So just knowing what you're doing, seeing the progress, and being able to be treated like a sensitive woman, to me, makes a difference.
One thing I think that is important to point out is a lot of women won't seek care when they have a symptom in their pelvis that's bothering them. In fact, research shows that 86% of women who are incontinent of urine will not tell their doctor. 14% will, 86% will not. So and I don't know why that is. I mean, no one has really looked at, is it embarrassment? Is it, some of those women might think that there's really nothing that can be done. My mother was incontinent, nobody helped her, so maybe there's nothing that can be done for me. There's probably a wide variety of reasons why women won't say. But once we know that a patient has a problem with, for example, bladder control, there are a variety of things that can be done based on her desires and her goals, most of which we will suit to how much time she's willing to recover and what her long-term goals are.
I remember how my mother suffered. And I remember that she just kept trying different medicines and stuff. It's not because her doctors weren't good, it's because they weren't knowledgeable in these areas. I thought getting up every hour and a half to go to the bathroom at night was something I was going to have to live with. I've had 3 treatments. I am now mostly just getting up one time during the night. And I can see very soon I'm not going to get up at all. So for those who have lived their life this way, this is a whole new life. And you can start changing that today, or you can go on for another year or 2 years in the misery that you're going through and then change it. So you come in, you're treated with dignity, you're treated gently, you're treated with respect, you become a part of your own solution, and you work together. And to me, that's all it's taken for me to make a drastic change in my life. So I don't know why you'd want to suffer anymore when the answer is tomorrow.